Southern Plains Medical Center presents your hometown medical minute, and your host, Hal Brock.
Hey everybody, and welcome back to your hometown medical minute. I'm your host, Hal Brock, and I'm very excited to be back. With me, as always, behind the cameras, our IT director, Mr. Ed Harrison. Thanks so much, brother. How you doing?
Doing good.
Well, good, man. We've got a really cool show for everybody today, and actually, I get to talk about some personal experiences because today we're bringing back our chiropractor, Dr. Chris Ludwell. Well, he's going to actually talk about some athletic stuff that he does in his office, including chiropractic adjustments. Obviously, for athletes, you harness a lot of that energy, and so that's what chiropractic does, kind of flush that out. And then as well, he does IV drips. Today, Ed, we're going to talk about Kinesio Tape. KT tape is what the young kids are calling it, and I found out, Ed, the last couple of weeks, I am no longer young. And Dr. Ludwell, he's my chiropractor. So today is really cool. We're gonna kind of dive in to some of the reason we took a pause, some of the things that I personally went through, and of course, Dr. Ludwell played a huge role in helping me kind of get through this little rough patch in health. And so I'm super excited to have him here today. Before he comes on, we actually want to talk about a health fair that's coming up. So next Friday, Ed, August 2nd, from noon to 3 p.m., SPMC is going to have a back-to-school health fair. And so, Ed, we're doing some great screenings during this. Of course, free sports physicals here for any school, any athlete. I don't care if you're in Tulsa, you're in town, Bella Thorne's been in town. If she played high school sports, she could come and do it. So the other screenings we've got a skin cancer screening. So Courtney Dahi, SPMC Dermatology, she's gonna be doing free skin cancer screenings. And now that, Ed, that's for everybody. So not just school-age kids. And of course, the physicals are for any athlete playing in middle school, high school, or if you need a sports physical, I think ages like 10 to 18. The skin cancer screening is for everybody. So if you're worried about anything, mole, anything, bump, rash, come in, let Courtney take a look at you. She's phenomenal. As well, we're also going to be doing free vision screenings with Southern Plains Vision Associates. Awesome. So everybody needs to get their eyes checked at least once every year or every other year, depending on any back problems, history problems. Also, our partner, Ed, in physical therapy, Valor Physical Therapy, they're gonna come upstairs. They're gonna bring their BioSway machine. Hey guys, this thing's really cool. And go back to Facebook, watch our channel, and take a look at this video that we did with Bobby and her team down there at Valor PT, and take a look at this. So it's a concussion protocol deal, and what it does, it measures athletes' balances, Ed, and then if they take an impact during the season, and we're worried about if it's a concussion or if it's a diagnosed concussion, and you just kind of want to see how you're progressing, you get back on this balance machine. It's got a couple different games, a couple different sets that it will log and will let you kind of compare where you're at pre-hit, where you're at after hit. So really cool machine. So definitely come check us out. Our friends down at Arvest Bank here in Chickasha are going to be here. They're going to be grilling out and providing free lunch. So hey, come out, get a free lunch, get a free sports physical, vision screening, skin cancer screening. We're gonna have other things set up and information for you, so come and hang out with us next Friday, August 2nd, from noon to 3 p.m. here, Southern Plains Medical Center in Chickasha, 2222 West Iowa. All right, well, let's bring out Dr. Ludwell. And actually, I say bring out, but we filmed it actually yesterday, so I'm wearing a different suit. So let's bring out the interview of Dr. Ludwell and talk about this Kinesio Tape. It's really cool for athletes, Ed, for volleyball players, football players, basketball, for cheerleaders, check this out. All right, so our guest is here today. I'm super excited for today's show. It's all about athletics, football's coming up, super excited. Dr. Chris Ludwell. Dr. Ludwell, man, thanks so much for coming here.
You're very welcome. Thank you.
Absolutely.
Thank you.
I'm pumped for football.
I am too.
Yeah, of course. I do the broadcasting for Chickasha High School, but then also I'm a huge OU fan.
Same here.
You are?
I'm a Sooner.
Man.
Undergrad. That's where I went to school.
Really?
Yeah.
I knew that.
Yeah.
That's awesome.
Yeah.
Are you excited for Jalen Hurts?
Man, I tell you what, I'm loving it. You know,
Yeah.
what did we do with the last 2 transfers?
I think Lincoln did a pretty good job with it. I think 2 Heismans.
I believe you're right.
Back-to-back quarterbacks.
Yeah.
Pretty special.
I mean, I think there's gonna be a third.
I do too.
Yeah.
QBU, man, and I think it's deserved. This kid did a wonderful job. Won a national championship for Alabama, and then got hurt.
Yep.
And got sidelined. And man, next kid came in. He was good. Took his spot.
Phenomenal.
But Jalen coming down here, man, I think he deserves the opportunity.
Well, you remember when when the other quarterback got hurt and he stepped in and pulled out that huge victory and stepped in as a role player and had no problems with it and was glad to do so.
Absolutely.
But I'm glad we've got him.
Man, me too.
I think he's gonna be a good kid.
There's a lot of you do some amazing things for athletes, and in a few weeks when I'm kind of ready, I want to sit down and do a testimonial video for you. Dr. Ludwell is my chiropractor, and you did something very important for me over this past month, life-changing, and it's putting me on a better path.
Awesome.
And so I definitely always want to talk about your adjustments, because what you're able to do as far as release for people is purely amazing.
Yeah.
And I'm a huge believer in it, and so I'm excited to talk about that. But today, you also do some really cool things specific to athletics, and man, CrossFit, football, I see it all the time. Basketball is huge. Shooting arms and stuff like that.
Yeah.
You're big into kinesiology tape. Am I saying that right? Kinetic tape? I don't know.
The very early terms was Kinesio Tape.
Okay, cool.
And then rock tape and K tape,
Okay.
KT tape. So it's somewhat expanded.
I'm old.
I am too. I still say Kinesio Tape.
Okay, cool.
But I guess the new buzz term is KT tape.
KT tape.
So
probably means kinesio something.
Yeah.
You know? Okay, cool.
It's just probably another company that's making money off their tape, which and there's so
Good
many.
for them.
Yeah, there's so many brands out there. It's all good.
Right.
But I still use as far as true kinesio taping, I still use the original kinesio tape.
Awesome.
And I have a few other taping techniques I use different kind of tape for. But kinesio tape is it's basically a rehabilitative therapeutic modality that allows the body to open up its own healing paths.
Ooh, cool.
Yeah, and it is so. By doing so, it will activate the neurological system and the circulatory system, and which is in combination is phenomenal.
Oh my gosh.
I mean, our body has a way of healing itself.
Yes.
We're just helping it with the kinesio tape.
100%. And you mentioned the release, and I kind of had mentioned that I'm kind of warming up into it, and extremely important to get that release. And so now, how does that actually work? So I mean, for me, when I look at when I was playing baseball, ETA, they'd wrap my ankles. When I was boxing, they do hand wraps and we'll do stuff like that. Obviously, different kind of tape.
Yeah, correct.
What is the difference between kind of the two tape methods and stuff, and what causes the circulation output?
That's a good question. So the therapy tape, like when you were fighting, you wanted to really support joints.
Right.
Because you didn't want to hit somebody and then your wrist come back this way, and because you're hitting with explosive force.
For sure.
So that taping is a little different technique. That was just more of your traditional white athletic tape.
Right, yeah.
And it's very stable. Your kinesio tape, and that is that you can't stretch that kind of tape.
No, yeah, it's just for a hand wrap.
Yeah.
And your boxing glove goes on it and stuff.
And you're probably double wrapping a lot.
Yeah, and then for baseball, wrapping ankles.
Right.
But that's for rollovers and keep it stable.
Exactly.
Okay, cool.
So joints.
Figured that out.
Yeah, joint stability. So athletic tape is
okay.
joint stability. Kinesio tape is for muscle. It allows the muscle to work properly in a healing process.
That's amazing.
So you're going to follow the muscle line, the muscle path on this with this Kinesio tape, because it stretches one way but doesn't stretch the other.
Oh, okay.
So what it does, you lay this on top of the muscle, it's going to basically attempt to pull the muscle off of the skin, off the layer of the muscle, and allow that circulatory system right underneath to bring in. So when it activates the circulatory system, it's bringing in good blood flow.
Sure.
Yeah.
For
so
sure.
it increases healing, and lymphatic flow. So we're bringing in new lymphatics, which is bringing in good cells, and we're trying to heal that area. So it you know, I didn't understand it in the beginning, but I'm a huge believer in it now because I've seen it work.
God, no kidding.
Yeah, so it's awesome.
Bro, we need to have like a strategic session ASAP.
And it's great. It's great. And there used to be an old doctor that was around here that he would adjust the spine extremity, and then he was ahead of his time. This was before Kinesio tape. This is before athletic tape. He was taping his patients right after an adjustment to help stabilize the spine and the muscle structure.
I see it.
Yeah, and it's great. So
it's amazing.
Yeah,
and I can see it in your adjustments.
Yeah.
You know what I'm saying?
Yeah.
I mean, because that release came out, and so I don't think the tape in my situation would have helped then.
I agree.
You know?
Yeah, I agree.
I think now
yours
maybe
was
that I'm
strictly
more
restrictions.
aware.
Yeah. Neuromuscular restrictions.
Yes.
Yeah.
I think that I'm more aware now.
Yeah.
I think I'd love to try some of it on like my legs because I'm trying to be a little bit more active and a little bit more healthy.
It's funny you say you're more aware, because most of my patients that I haven't treated but maybe just once or twice, they'll come in and they'll use that same, they're like, well, I'm experiencing this now. They're more aware of what their body's doing because we've placed them in a normal position, and now they're understanding the abnormal or the aberrant motion that they didn't really realize they had in the beginning.
100%.
So it's good body awareness after a good adjustment to.
It's been crazy.
Yeah.
That's a real thing.
Yeah.
The emotional release, it's a real thing.
Real thing.
And it's hard to describe.
It is, even for me, it's hard to describe, because I've had patients come in on their initial adjustment, they broke down crying.
Yeah.
Not because they're hurting.
No, I know.
It released an emotional.
Yeah.
They've laughed.
Yeah.
They've screamed. They've talked. You know,
just uncontrollably.
Just uncontrollably, and it's hard to understand. I can't even really put words to it, and I've been doing this for 12 years.
I'm gonna try for you in a testimonial video here pretty soon, because it's been life-changing for me.
That'd be awesome.
So I want to double back real quick on the tape. We've got, so I would think the big fall sports in my mind, the ones that start right off the bat, cross country, you're gonna have volleyball and football.
Correct.
And then the basketballs come in. And of course, archery is a year-round program. There's a lot of things I think that can benefit from this KT tape or Kinesio tape. I see a lot of CrossFitters do it.
Tons.
Could you talk about some of the benefits? And I know you did, but pertaining to, let's just start with football and volleyball. So if you had one of each come into your office, for the football player, how do you feel the taping might benefit both while in practice and in game, or just outside? You know what I'm saying? Like trying to come down, relax, or trying to do something else.
That's another good question. In football, I believe that it's very position specific.
Okay, cool. Understand.
Because a quarterback is going to use different arm motions than an offensive lineman.
Absolutely.
So lineman's coming up, so he's using a lot of anterior shoulder, a lot of upper chest. Quarterback, he's using a lot of bicep and back because he's throwing a lot. So we would have to place the Kinesio tape in different positions to help facilitate whatever kind of movement this player is basically repetitively doing.
Okay.
And and again, we're trying to offset that repetitive stress syndrome. So
awesome.
Somebody that does something over and over and over, well, you're going to wear that part out.
For sure.
Yeah. So we'll tape that in attempt to offset that.
Okay.
So volleyball, I see a lot of, especially the volleyball players who will serve overhand.
Right. Oh my gosh. I mean, because that's a lot of force.
Yeah,
and like, instead of a baseball or a football having something tangible in your arm back
Yes.
here and being able to release it,
Yeah.
it's a different throwing motion
Yeah.
than if you're just not doing anything and
Right.
then you're hitting something.
Well, because there's no impact until
right
here.
there. Yeah.
And that's a very weak weak
sure.
joint, because the shoulder, I mean, you have 17 muscles that attach right here.
Holy cow.
And they're coming in all different directions. So which one is weak, which one is, so you have to really be, and that's where your orthopedics come in.
Okay.
That you have to really assess the situation and say, okay, we have a problem with the supraspinatus muscle, which is one of the 4 rotator cuff muscles.
Wow.
Versus
4 rotator cuff muscles?
Yeah.
I played baseball for 24 years.
Yeah.
On another 4 muscles.
Yeah.
You hurt your rotator cuff, you got a rotator cuff injury,
Yeah.
you're
Yeah.
out for 3 months,
Yeah.
you'll be fine.
They just group them together.
I didn't know it.
So they're very specific. So they're
Okay.
coming at different angles. So if you have like 90% of the time, it's going to be the supraspinatus that comes across the top. But if you have one that comes from the back,
Yeah.
underneath the shoulder blade, that's a different taping technique.
Wow.
So very specific.
That's awesome.
Yeah.
I can see this is so prevalent for volleyball just because, like you said, I mean, when you're flailing something as fast as you can without resistance,
Yeah.
that's dangerous.
Yeah.
No matter what you're doing.
And then the dig.
Oh, okay.
So
okay.
so they're floating out there
Lunging.
with both arms,
Yeah.
trying to dig the ball. Well, then if they impact the ground on an outstretched arm,
Ooh.
and then they, injure themselves that way, that's a different technique too. So
Man, even having these, because I can see if you've never done it, you might not want to do it for a game. Can you imagine having this? Because you're not really repeating it as much in a game as you are repeating it 100 times over and over and over until you get it right in practice.
in practice, that's a good point.
How amazing would it be
Yeah.
for practice? Some of these volleyball players, look, I mean, I'm being serious. I think this is, I fully believe
Yeah.
in what you do as far as adjustments. And I've obviously seen at the professional level, this taping has really taken storm over the last couple years,
It has.
right?
I believe it was 2 Summer Olympics ago
Okay.
is when I noticed a real. But you're right, volleyball. And that's the sport I was watching where I noticed it was volleyball.
Really?
Yeah.
It
It
just makes total sense to me now that we're
It
sitting here
does.
having this conversation.
Yeah, because we don't want to lock down the joint.
No.
We want to allow the muscle to work to its full potential. So why not help it out by, allowing a little more blood flow and neurological impact into that area. So
That's so awesome.
it's
So what we're gonna being able to tape around that, and like you said, have that blood circulation.
Right.
Because when you're catching and you're on your knees, if you don't have knee savers, you might cut off some circulation down there.
Then you can, and kind of a little shoot off of the Kinesio tape. I use another taping technique with Elasticon,
Oh.
which is in between the athletic tape and the Kinesio tape. So
Okay.
we're hitting the muscle a little bit, but we're also stabilizing the joint in more of a kinetic fashion.
Awesome.
So you still have movement. So it's like you go get a brace for a shoulder
Okay.
or a knee, but the taping technique is very slimline. You have more you have the same
Yeah.
mobility. It's just more stable than a brace.
That's awesome.
So that's a different type of taping.
That's good stuff, man.
So that'd be an injury type deal. A guy throws the ball in the football game,
Yeah.
gets hurt, he comes on the sideline. We're doing this certain kind of technique to get him back into play
Wow.
with the joint stable.
Man, I mean, my business mind is just running. I could go and sell you. No, just kidding. But, I mean, athletic teams, and I guess that's why it's becoming more prevalent, and I'm seeing it. I've seen it in some NBA camps.
Yeah.
Shooters wearing it on under their arm. I guess that's for that release, and making sure that their shoulder's staying tight or something like that.
Yeah.
I might even let you just tape me up and then go hit a volleyball with you somewhere.
Right.
You know what I'm saying?
That'd be cool.
That'd be cool. Well, hey, brother, thank you so much. I'm super excited to learn more and more, of course. We're just now kind of revamping back, of course. I'm going to talk a little bit more about why I've been absent. That is for another time. Dr. Ludwell, thank you so much for taking your time.
Thank you.
coming out here and talking to us about that. Kinesio Tape, guys, KT Tape. Look it up. Dr. Chris Ludwell does it right here at Southern Plains Medical Center. Give us a call, 405-224-8111. Hey,